AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher, a guest in studio today from Central District Health Department. John Amanjo is here to bring us up to date on some important things that are actually being discussed all across the country today. First off, welcome back.
Thank you for having me.
The U.S. Antibiotic Awareness Week information series is going on, and I bring this up because there are some complications to this. Folks hear about antibiotics. They assume things about antibiotics, but there really is some education going on, so I'm going to let you start filling in the blanks for all of us.
Thank you. So this week is Antibiotic Awareness Week, as you mentioned, and it's just this opportunity to highlight the important use of responsible antibiotic prescriptions and when you take them as a patient, to finish your prescription. Antibiotics don't fix everything. So if you have a virus, cold, flu, RSV, COVID, antibiotics aren't going to help that. And so sometimes people think they will help, and they don't. They actually just breed antibiotic resistance. So pretty soon, the antibiotics that we have aren't going to work against certain bacteria. And so that's why it would be important to finish your prescription and only take them when you need them.
In other words, you can complicate your own situation by thinking you're doing the right thing, but not really following the directions.
That's correct. And so more than 2.8 million cases of antibiotic-resistant infections occur every year in the United States. So that means when we prescribe you antibiotics, they're eventually not going to work anymore. So then where will we be? When you think of things like pneumonia and sepsis, when those become resistant to antibiotics, what will we have left to help fight those infections? And so that's why responsible antibiotic use is important and often overlooked.
We've heard about some germs or strains or whatever that have become resistant to medicine. So this follows along that same thing. This is why it's really important to understand that certain things affect certain conditions. You have to be aware. If you need to double check, pharmacist, healthcare provider, whatever it is, even the health department can help provide some answers.
That's right. All of those things are a way to go. We actually partner with the Nebraska Infection Control Assessment and Promotion Program, as well as the Nebraska Antimicrobial Stewardship Assessment and Promotion Program, to help ensure, just like another double check, that we're using antibiotics responsibly, especially in healthcare settings and long-term care settings. So we're partnering to get that extra step in there.
You probably heard a lot of different things, a lot of different terms today, and at times it can be a little bit confusing. So if you have questions, visit with your healthcare provider,
Absolutely.
Visit with your pharmacist. If they want to visit with the health department, what's the best way to reach out?
They can give us a call at 308-385-5175, and we can help refer them if we can't answer their questions.
Okay, but otherwise, is there information on the website too?
Yes, there are.
cdhd.ne.gov.
Correct.
Whew, got it all out in one breath.
Yeah.
John Amanjo from Central District Health Department, have a happy Thanksgiving.
You as well. Thank you.
Good morning from AM 1430 KRGI, 105.5 FM.